All right. Okay, doctors. So we will start the session now. Okay. Dr. Foki, I don't drink. As long as everybody behaves well in the group, I am more than happy to help. Okay. It doesn't have to be in exchange of anything at all. Okay. So thank you so much for offering. But I don't drink. As long as you all behave well in the group and respect each other efforts, that's what matters to me. All right. Okay. All right, doctors. So doctors, here we are with our Breaking Bad News station. Okay. So doctors, Breaking Bad News station, as I say always to my doctors, everything has a pattern in Plab exam. Absolutely everything, okay, has a pattern. And the stations have to be grouped together in order to make your life easy, okay? No matter how many times you read the scripts, and if you go without an approach to Plab exam, trust me, standing outside the cubicle, you will be lost. And anybody, anyway, becomes lost inside the cubicle. All right, it's quite common, but as long as you have an approach, you will not be lost. Okay, no matter how many times you by heart the scripts, no matter how many times you practice, if you have practiced wrong, if you have followed wrong approach, you will never pass a particular station. All right, so everything has an approach. All the stations, okay, there are 340 something stations now. Now, all these stations should be grouped in different categories, and different categories of stations have an approach to them. All right, trust me, absolutely everything has an approach. And when you have an approach, that's when you can just approach any new stations as well. Doctors, I swear I had two stations, new stations in my exam, and I cleared both the stations just because I had an approach. And that's what, when I teach my doctors in the course, I tell them that if a new station comes, please just follow your approach. Doesn't matter even if you do not know the definitive management. All right, as long as you are following the approach, you're going the right path, you'll be fine. All right, so here you go. Breaking Bad News stations have an approach. Okay, now what is that approach that we have to follow for Breaking Bad News stations? Doctors, first of all, just remember, for now I'm just going to give you the points. Just write down the points, all right, and apply to any Breaking Bad News stations. Okay, so first of all, Breaking Bad News. Okay, it is bad news is always shared with the patient in layers. Okay, in a minute I will also tell you what layers are. Okay, I will also tell you what the layers are, but for now, just remember that always any bad news station, whether it is ductal carcinoma in situ, which also appeared in the exam recently, or it is a massive stroke, or it is the HIV diagnosis, or if it is both the Joshua cases, okay? Both the Joshua cases, the child accident, road RTA cases, okay? Road traffic accident cases, where the child has, in one of the station, child has broken pelvis, in other station, child has intracranial bleed, okay? Now, all of these stations, doctors, they are all Breaking Bad News stations. And as I said, Bad news has to be broken in layers. All right. So I'm going to explain to you in a minute what layers are. Just your number one point to take home. Okay. Now, secondly, I have been taking mocks, and I don't know, when I ask doctors, have you attended any academy? When I ask them these kind of questions, they have attended academies. Some of them have even gone for online courses, and I have no idea why they were never told that, hello, do you remember that there is something that you are marked on, and in your one of the column in your marking is history taking, data gathering, and doctors don't take any history in these stations. Okay, so why they fail? Please put an asterisk next to that line, or maybe write it in bold with a pen, red pen, or with a golden pen, but write down so that you always remember that even if it is a Breaking Bad news station, I will still take the history. Okay, I will tell you in a minute what history you need to take and what is the reason. Doctors, there's always a reason why you do something, okay, in Plab exam. And if you understand the logic, it's easier for you to remember in Plab exam that why am I taking history? Okay, so number one mistake doctors make, they don't take history in Breaking Bad news stations. For example, it is written outside, the task says that, for example, an elderly man had intracranial bleed, or he had a stroke and now he has another massive stroke. Okay, and no further active treatment is to be given, and only palliative care is possible. Doctors go inside, they read the task, they think, oh yes, it is Breaking Bad news station, I know this station very well, and they go and they think that I'm just going to go and break the bad news. No, doctors, no, please don't do that. When you take history first of all, you should take history because, especially, let's talk about just this station for now, okay? The station where the patient has had a stroke previously, and now they had another stroke, okay? Another massive stroke. All right? Doctors, they keep changing this scenario ever so slightly, okay? Sometimes there is a son you have to talk to. Sometimes there's a daughter you have to talk to. Or sometimes you are calling the daughter over the phone. It's a phone consultation like it was this time. Okay? So you're going to call the patient's relative to give the bad news. All right? So the station is the same, but they make slight changes, and doctors believe that it's a new station. It's the same old station, just the slight changes in it. All right? So number one, I told you that you will, first of all, you will take history. You'll remember, first I have to take history. The reason for taking history is, now in patient who had a stroke, okay, for example, later on when you have broke the bad news, when the person is becoming very emotional, the relatives becoming very emotional, in that emotion, they may ask you, doctor, why did my father had this stroke? Why did it get so worse? Will you have an answer to that? No, you will not have an answer. If you have taken history, if you have asked her or him, if it's a son or daughter, if you have asked them that whether the father had any medical conditions, for example, in this case, always they give the history that, yes, doctor, my father had a previous stroke, or they will give you a history that, doctor, yes, my father had blood pressure, high blood pressure. Okay? So at least if you have asked in the history, does your father has any medical conditions? Yes, doctor, I'll talk about the course in a bit. Okay? If you need some more information about the course, I will, at the end of the session, I will send the details, okay? If you want to know about the course. All right? Okay. So doctors, come back to our station. Yes. So the need to take history, Okay, I told you why we need to ask the history. Second reason, doctors, now if you have not developed rapport with the patient at all, when you're asking history, when you're slowly talking and going through the station, you would have become comfortable yourself and the patient could have become comfortable. Now, creating that comfortable environment makes it less challenging for you when you have to break a bad news. Okay, patients relative becomes mentally prepared. Okay, and you calm down a little bit. Okay, so actually taking history first will help you. Okay, it will work in your favor, trust me. Okay, and for the sake of those 4 marks in your, remember I told you that, I don't know if you doctors, some of the doctors have attended first ever of my sessions where I told you that the actually doctors, I will please hold your horses, I will tell you about the course. Okay, I will tell you about the course. All right, let me finish the station first. All right, okay, so you have to, where was I? Yeah, so you are marked actually in 3 areas, doctors. Okay, you are marked for your interpersonal skills, you are marked for data gathering, and you are marked for management, remember? So data gathering, how come in Breaking Bad news station, why I don't understand why doctors don't take history? So please remember, take home today this biggest lesson that any Breaking Bad news station, now in ductal carcinoma in situ, why you are taking history? Because you will explain to the lady that why the hell she developed this cancer. Because she might be smoking. She might be having a family history of breast cancer. Okay? Or she might have never breastfed her children. Or she might have had an early menarche. Okay, so if you had taken history and you correlate things, doctors, whenever examiners just love this, whenever you bring back things from your history to your management, they love this. Okay, if you have asked something and you mention again in your management, as you said, Mr. John, or as you said, Miss Alina, you are smoking. Also, unfortunately, you have a family history of breast cancer. Now, all these things, now connecting the dots just makes sense that why you could have had, because you had some risk factors, unfortunately. Okay, ductal carcinoma in situ, and I'm giving you reason why you need to take history. Why you need to take history in this particular station, in a massive stroke station. Because you can explain to the son, you can explain to the daughter why the father, because there could have been a dodgy diet, some problem that, the lifestyle. For example, they were physically inactive for a long time. They were smoking. Their diet was, for example, very unhealthy. They did not follow up with their doctor for a long time. Okay, so asking all those things in the history, you can use in later on in your management. Okay, when the patient's relative asks you, why did my father have this? Okay, now doctors, another mistake doctors make. Doctors, please let me have a sip of water. Okay, another biggest mistake that doctors make in Breaking Bad news stations, that there are many questions that they do not know the answers to those questions. Okay, for example, a very common question asked in Breaking Bad news stations is, doctor, is it serious? Doctor, is my father going to die? Doctor, is it life-threatening? Doctor, how much time my father has? And you know what? As soon as that question comes up, some doctors get nervous. Some doctors cook up stories, which is, let me tell you doctors this, that this is absolutely contraindicated in Plab 2 exam. Cooking up stories. You can always use the information. You know what your medical notes are. Your medical notes are your task. Okay? The history that you have is from your task. Okay? Whatever you will say, I can see from my notes. But please never ever cook up stories. Never ever say things from your own side. If you don't have the answer to something, please be honest. Okay? Please be honest. The doctors give wrong answer to these questions. Doctors, don't worry. You might be thinking that Dr. Asya is just giving us pointers and she's not going through the station systematically. This is how I usually teach. I give an overview first and then I go through the slide systematically. Okay? All right, doctors. So I hope you have understood the importance. I just want to do something that is the most common reason for failing this breaking bad news stations, and doctors do the whole bad news. And by now, by the way, by now, everybody knows that we have to break the bad news in layers. Sometimes doctors do the layers wrong. They don't even know, because most of the academies, they do teach the layers. They say you have to break the bad news in layers, but nobody tells you what exactly the layers are. Okay, so that's what you have to know, and then you can just apply. Doctors, I have done mocks. I have been doing mocks with some of the doctors, and some of you, okay, some of you do have okay. Okay, Dr. What's her name? Dr. Minfas. Okay. All right, doctor, I'm taking your number. All right. Let me just, doctor, just give me a second. Okay. All right, doctor, don't worry. Even if you have to go, no problem. I'll give you the information. All right, Dr. Minfas. All right. Okay. All right, doctors. So I'll explain to you what the layers are. Okay, you're very welcome, doctor. All right. So, doctor, first of all, the way this station presented this time, let's discuss that. Okay, it came as a phone consultation. Okay, and yes, doctor, I will. Don't worry, doctor. I'll answer this. Okay, I'm going to. I never have any questions unanswered. All right. So if I have said that I will tell you how to answer these questions, I will tell you ultimately. Okay. All right. Just hold your horses. All right. Okay. I will reply to that in a minute. So, doctors, it came as a phone consultation. All right. So I have done a free session on phone consultation as well, because your introduction in phone consultation is a little bit different. I always warn my doctors in the course that whenever your introduction is a little bit different, when you're in a different situation, you get nervous. For example, you're always practicing this way. Hello, I'm Asya, one of the doctors here. How may I help you? Or hello, I'm Asya, one of the doctors. Can you please confirm your name and age for me? And whenever it is a relative, you get nervous all of a sudden. Okay? Or you even ask that, may I know your name and age? Why do you want to know the relative's age, by the way? Is there any reason for that? No reason for that. No, unless or until the girl is really beautiful and you want to know her age. But jokes apart, okay? Never do that in Plab 2 exam. You're not there to flirt after spending so much money. All right? So don't ask relatives' age. Okay, doctors? Whenever, if it is possible, you can see the name outside the cubicle. Okay? Or if it just says talk to the son or talk to daughter, confirm their name. How may I call you? Okay, how may I address you? May I know your name? Doctors, please don't try to be over sophisticated or over complicated. If it is not your first language, and you just, you may sound, uh, illogical. Sometimes people sound weird. It's not their first language and they are trying to use very sophisticated words. Trust me, it's not an exam for English. However, if you are trying to speak sophisticated English, okay, sophisticated English, but wrong, then they will mark you in the language area, okay, if they are not unable to understand you. All right. So always remember, you have to use the simplified version of words. Trust me, the way you child your son or the way you teach them when they start speaking, that what is your name? Simple sentence, just ask the person, what is your name? Okay, don't try to be over sophisticated, because you might fall into your own trap. Okay, may I know your name? Simple, may I know your name? Okay. Okay, she says, I'm Eliza. Okay, then ask, Eliza, can you please confirm your relationship with, I'm here to talk about Mr. David William. Can you please confirm your relationship with him? Okay, I'm his daughter. Okay, so if you're talking over the phone, okay, you say, I am calling from GMC hospital. Hello, I'm Asia, one of the doctors from blah blah department, whatever department tells you you are from. Okay, your task will tell you which department you are from. Okay, but which hospital you are from GMC hospital. Hello, I'm Asia, one of the doctors from calling from GMC hospital from A&E department. Can I speak to Mr. I'm calling regarding Mr. David Williams. Okay, and then she says, yes, I'm his daughter. Then you don't need to confirm the relationship. Okay, can you please confirm your name, or can you please tell me your name, or may I know your name, please? Okay, and then start this rest of the station. Okay. Now on telephone consultation, doctors, we also confirm the address of the patient, okay, or the relative. And we also confirm, is it the convenient time? Okay, after you have introduced yourself, is it the most convenient time to talk to you right now? Okay, and then after that, you also, can you please confirm the first line of address, your first line of address for me? And then if at all the call breaks, or if at all the call drops, can you please confirm the number I may ring back? Okay, or can I ring back on the same number or any other? All right, so you are done. This is the part of phone consultation. Okay, and then later, now come to your the gist of the station. What is the station here? Because it's normal day-to-day life, even British people won't do it. Your comments, please. Yes, I agree with that, doctor. Okay, one of the doctor is saying that is it okay if we say that, how may I address you? I totally agree with that. I have been in the UK for the past 10 years. In whole, done my master in public health. I have done my MBA here. Never ever, I have worked in my husband's company. Never ever I have seen anyone saying this, that how may I address you? No, no matter how formal anybody is, they will never say this. Okay, so simple, make it simple. Okay, make it simple. You're very welcome, doctor. All right. Okay, doctors. So yeah, come back to the station. All right, we have done the introduction part. Now you will tell her that well, may I know that how much do you know about your father? Okay, you have already told her that you are calling regarding her father's condition. Okay, and now tell her that well, I need to discuss something about Mr. David Williams. But before I discuss that, may I know how much do you know about his condition so far? Okay, how much? Check her knowledge, how much she knows. Okay, and then she will tell you, yes, doctor, he has been admitted in the hospital, I know, and he had a stroke. But well, I know so far I know that he was recovering well. That's what she will say, that he was recovering well. Doctors, that is your this is still, you are going to do your, you are just going towards data gathering. Okay, you are trying to take history. Okay, how much she knows about her father's condition. She will say that yes, he was admitted, he was recovering well. Okay, and then you will say yes, you are very right, he was recovering well. I need to speak about his recent condition, but can you please tell me, if at all you have any information about his health? How has his health been generally? Well, doctor, he's okay. Every now and then he does have some problems. And can you please tell me more about it? Doctors, tell me more about it is your golden sentence for Plab 2 exam. Tell me more about it. Okay. You are not given credit for asking more questions. You are given credit for asking appropriate questions. Okay. More the simple, doctors, again, I want you to benefit from these sessions as much as you can. That's why I try to give. I don't care that some of you uh, you are in my groups. Okay, and it's not paid, but I don't care. Okay, I just want to give you as much information as many doctors. I see this mistake very commonly in mocks, that doctors combined the questions. Okay, they ask compound questions. One question, do you have any tummy pain and vomiting and this? Oh my gosh, I want to ask you, doctors, that how would you feel if somebody did that to you? So ask one question. Okay, one question at a time. One question at a time. All right, so ask one question, get the answer, then the next question. All right. Okay. So doctors, now she tells you, and she tells you that now you will ask me, doctor, what part, how much history do we have to take? Now I told you the reason. That's why you should know what question you should ask. I told you the reason. His lifestyle will matter. Okay, if his lifestyle is dodgy at all, diet, exercise, smoking, alcohol, family history of strokes, okay, as well as his medical conditions, his previous medical history, all these things will impart, all these things would have led to this massive stroke. Okay, so that's what you need to ask. You need to ask, can you please tell me about his lifestyle? How was it? If she specifically, or you can say being more specific, how was his diet? Was he physically active? Does he smoke at all? Does he drink alcohol at all? Okay. Does he have any medical conditions? Yes, doctor, my father has high blood pressure. All right. And I tell my doctors always to make your life easy. Whenever there is a yes to any medical condition in Plab 2 exam, you're going to apply 3C approach. Okay, 3C approach. First C is condition. And your question regarding the condition should be, for example, in this case, the condition is what? High blood pressure in the past. Okay, so you should ask that since when has he was diagnosed with high blood pressure. Then the next C is control. How well controlled was his blood pressure? Next one is compliance. Okay, how was how was the control? How was he controlling it? Any medications was he using? And compliance is that, was he regular with his medications? Was he regular with his follow-ups? Okay, or was he following up with his GP every now and then? Okay, 3C approach, doctors. Anywhere in your Plab 2 exam, absolutely anywhere. Okay, whenever there's a cue, the cue is verbal. And what is that? Doctor, I have depression. Doctor, I had insomnia. Doctor, I had kidney problem. Doctor, I had high blood pressure. Apply 3C everywhere. Okay. Tell me more about it. Okay. When were you diagnosed? How do you control it? How well controlled it is? Any medication that you use? Are you taking them regularly? Okay. All right, doctors. So doctors, I will answer your questions, and in the end, I'll read all the questions. Otherwise, I'll keep stopping. Not everyone can stay that long. All right, don't worry. I'll answer your questions at the end. All right, doctor. So this is your data gathering. All right. And then this is how much data gathering you need to do. And then examination. What is in your normal stations, which are history taking and management station. Okay. You just verbalize. When it is not a combined station, you just verbalize the examination. But you would ask me, well, Dr. Asia, they have this column of examination for all the stations. What about this station? What will be the examination for this station if at all I have not verbalized? Okay, then you have to verbalize the examination this way. You will pick up the information from your task, okay, and you will use it here. Okay, for example, which information you will pick up from the task? You will pick up the information that what all has been done so far for her father. Okay, ask her, do you know what all has been done for your father so far? Okay, and if at all it is in the task, tell that how his condition has been managed so far. All right, so then we had him, we have been managing his condition by giving him some fluids so that he stays dehydrated. Initially, he was examined from head to toe. We have assessed, we have done all the investigations. Okay, he was resuscitated and he was recovering well. Okay, he was recovering well. He was given oxygen, fluids, he was given painkillers. Okay, and doctors have assessed his condition. Now, in this case, usually it is written in the task that yes, doctor, I did do it. Yes. Okay. Yes, I did. All right. People do think of alternative career paths, and yes, I did think at some point of time. Okay. Anyways. Right. So where were we? Okay. So doctors, then you will tell that what was initially done. Now the task will say that a CT scan has been done and a massive hemorrhage. Okay, they have seen on CT scan a massive hemorrhage. This is what the information I say to my doctors. Sometimes you just have to copy paste the information from the task. So this is the point where you will copy paste the information from the task. Okay, that a CT scan has been done for your father. Okay, and did you know, has anyone, that is your layer 1, doctors, by the way. This is where your layers start. Okay, this is exactly where your layers start. Has anyone discussed with you the CT scan results? Okay, and then your layer 2 is, before I discuss the results with you, do you want anyone to be with you, or do you want to give anybody a phone call before I discuss? Okay, so that is, doctors, usually no matter where you go, this is not just for Plab 2 exam, even in practical life, these layers you have to remember for lifelong. Okay, if you're planning to work in NHS, you always have to remember these. Now the second layer is to check the support system. Okay, the first layer is kind of a shock absorber. This seems like it's an illogical question. We know that no one has discussed the CT scan results with her, but the first layer is just for the sake of being a shock absorber. Okay, has anyone discussed with you the CT scans results so far? Okay, or has the CT scans results been revealed to you at all? All right. And your layer 2 would be checking the support system, if she has any support near her. Okay. All right. Okay, doctors. Then uh, layer 3, doctors. Layer 3, you will reveal. Okay. You will reveal the diagnosis now. Okay. Unfortunately, I don't have a good news for you. This is your layer 3. And right after the layer 3, please don't wait anymore, because doctors start waiting here as well. Okay, don't wait anymore. Once you have told the patient you don't have a good news, don't start creating the suspense anymore. Okay, just reveal the news. Just say it. Okay, say it out loud that unfortunately, on the CT scan, we have noticed that your father has had another massive stroke. Okay. And I wish I didn't have to say this, but unfortunately, this is a terminal condition. Okay. Doctors, pause, please. Pause after revealing the bad news. Okay. After saying one sentence, please wait. Okay. You have to wait. And how much do you have to wait? Now, another mistake doctors make here, they wait here forever because the academy has told them to wait. So they think I have to wait here forever. Please, you have to finish your station. You only have 8 minutes. Okay. So you don't have to wait, maximum 10 seconds. Usually what I have noticed, the Plab 2 simulators, they will not make your life unnecessarily troublesome. Okay. They will probe you. Okay. They will prompt you if you have not spoken yourself. Okay. They will say something to continue the conversation. If at all the patient's relative doesn't speak anymore, then after the 10 seconds you should start speaking. Okay. And what you should start saying at this point, what you should start saying, I know. Now, sympathy. Okay, now comes the part where you show sympathy. Now, doctors, please, everyone taking my course shouldn't be using the same sentences. Throughout my course, I say one thing in 3 different ways. Okay, the only purpose of saying one thing in 3 different ways is so that you use your knowledge of paraphrasing and you all are different on your exam day, not the robots who are talking just from the mouth of one person. Okay, so you should use different sentences. Now, for example, I'm going to give you different sentences for sympathy. Please follow. Okay, now you can say, I know it's a lot to take in one go. Okay, I know it's a very difficult sentence. Number 1 was, I know it's a lot to take in. Sentence number 2, I reckon it's a very difficult situation for you as his daughter. As being Mr. John's daughter, I can understand. I can totally see your situation. It's very difficult time for you. Okay. And you have to offer her support now. Okay. Now is the time when you have to offer her support. Please don't worry. We are here to help you and support you. What is important that we talk about Mr. Mr. David's management or further treatment. Okay, I need to tell you. Okay, or the reason for calling you is because I need to tell you about how we're going to manage your father's condition further. Are you ready for that? Yes, doctor, go ahead. I want to know what you're going to do for my father. Okay. Now, I really wish I didn't have to say this, but unfortunately, multidisciplinary team has assessed your father's condition, and the team of doctors believes, doctors never say, your task actually says the team has decided, but the patient can backfire on you by saying that, what the hell, decided? You guys have already decided about my father? You're going to kill my father? Don't say decided. Believes. Your words matter a lot in Plab 2 exam, doctors. Choose your words wisely. So the team of doctors believes that he will not benefit from active treatment. Now, what are you doing again? Copying, pasting from your task. Okay. This will be in your task, that active treatment will not help the patient anymore, or the multidisciplinary team has decided that no active treatment should be given anymore. Okay, and only palliative care is important, and that's what you're going to say. Okay, doctor, can you not do surgery? I wish, Miss Elena, I wish we could do that, but unfortunately surgery will not help your father's condition. Okay, so then she might say that, doctor, is my father going to die? Is it life threatening condition? Doctor, is it very serious? Okay, I'm afraid I don't have answers to all of your questions right now. Okay, however, we will discuss, okay, we'll discuss Mr. John's condition or Mr. David's condition with you further. And then, however, in this situation, at times we have seen that patient's condition can deteriorate. Okay, patient's condition can deteriorate, or patient's condition can get worsened. Okay, or patient's condition can become worse. Okay, doctors. So in Plab exam, I always tell my doctors the easy way to remember this is that you always tell the truth, but covered in sugar coated words. Tell the truth, but first sugar coat it. Okay. So how do you sugarcoat your words? If you have to say that you are not sure if he's going to die, that's what you are, right? You don't know how is he going to die, when is he going to die. All right, you just know that these patients can deteriorate all of a sudden, they can die all of a sudden. Okay, but they have 2 days, 3 days, they might survive for another week. Okay, so you don't know right now. All right, so what you have to say, doctors, don't worry, I'll read at the end, I'll read the whole chat. Okay, I'll tell you, doctors, I'll answer your questions. Okay, so doctors, coming back to that question where the patient says that, doctor, is my father going to die, or is it serious, or how much time he has. Okay, now unfortunately it's a very uncertain situation. Okay, it's a very uncertain situation. We are not, I'm afraid I don't have answer to all of your questions. Okay, but okay, but in the past we have seen in this situation patient's condition can worsen all of a sudden. Okay, now there are different reasons why the condition can get worsened. For example, they can develop some fluid in their lungs, or they may aspirate some food particles. Okay, or they can choke on food all of a sudden. Okay, so their condition can get worsened because of that. All right, or they are very prone to developing infections as well. So one reason, just give 1 or 2 reasons, just give why their condition may become deteriorate, and they may just die. Okay, don't say like that, they may just die. All right, okay. All right, doctors. So doctors, we were on the question. Okay, now here, yeah, so now you also have to tell her, because it's part of the question, that no chest compression, no CPR should be done. If it is at doctors, please don't be scripted. Only if it is written in your task that no CPR should be given, then only mention to the patients. Sometimes in the stroke station, in this massive stroke station, sometimes they do not write that about the CPR. Please don't mention them. Okay, if at all it is mentioned in the task statement, I told you early on that please never cook up stories in your Plab exam. Because why you cook up stories? Because the station was different, the statement was different in your scripts, and that's what you are trying to do now, copying and pasting it. Please don't do that. I'm saying copy paste from the task statement in the exam. Okay, so if it is there, if it says that CPR shouldn't be given, doctors, I have noticed with the doctors, they say CPR because don't fall into your own trap again, because patient may ask you again, what is CPR? Okay, so that will make your life even more difficult, or you may even lose some time explaining the CPR. So just say chest compression or reviving the heart. Okay, so just tell her that we might we the team believes that your father will not your father has a terminal condition. That's why once if his condition deteriorates, we will not be giving him, or we will not be reviving his heart, unfortunately, or we will not be giving him chest compressions. Okay, all right, doctors, let's go to next slide. Okay. Okay, so doctors, he might ask you, doctors, she might ask you that, doctor, that does that mean you said you are not going to give him chest compression? You said that you will not keep him. She might sometimes, doctors, she even asks you that, doctor, are you going to put him in ICU then? Okay, how do you answer that question? Okay, first of all, you tell her that what are the patients that we put in ICU. Okay, and then tell her that we will not put her father. Okay, usually the patients are put in intensive care unit in order to give very aggressive treatment, or aggressive in order to give them aggressive medical treatment to save, in order to save their life. Okay, so that's your father, as your father will not benefit, the team believes that your father will not benefit from the medical treatment. That's why keeping him in intensive care unit wouldn't matter at all. Okay, so he will the treatment that we need to give him can be given even in the normal ward as well. Okay, so doctor, does that mean you are not going to do anything for my father? I'm so sorry if I have come across that way. Whenever patient says you something and you didn't mean that, you can just use this sentence in Plab 2 exam. I'm so sorry if I've come across that way, or I'm so sorry if I sounded that way. We'll look after Mr. John as much as we can. Okay, we'll look after Mr. John as much as we can. We are going to keep him in hospital and going to give him palliative care. Do you have any idea what palliative care is? Okay, and doctors, then quickly, if you have time, just give her an idea what palliative care is. That he will be given, if at all we find that he is dehydrated, he will be given IV fluids. Okay, or he will be given fluids through his vein. He will be given painkillers just to keep him comfortable. We'll give him painkillers. Now, the patients who are bedridden for quite a few days, they can even develop bed sores. We will make sure we'll look after him for that. We'll make sure that physiotherapist is always visiting him and changing his position so that he does not develop any sores or his joint do not become stiff. Okay, we'll also look after, or we will also care for his mouth care so that he does not develop any infections. Okay, and we will also put some compression stockings for him so that he does not develop any clots. Okay, now doctor, she might say how much time he has. Okay, hard to say. And complications, as I said here, you can say it's very difficult to say in your father's situation. The condition can become worsen all of a sudden. Okay, just sugarcoat it first. Okay, tell the truth, but sugarcoat it first. All right, doctor, can you please put him on ventilator? Okay, can you please put him on ventilator? May I know why do you what makes you ask this, or why do you want us to put him on ventilator? Okay,
First of all, ask the patient if even if they know or not what ventilator is. Okay, then in your task, doctors, now you are not making up stories. At the moment, Mr. John can breathe on his own, and ventilators are used when the patients have problem breathing. Okay, and fortunately Mr. John can breathe on his own right now. He does not need any ventilator right now. Okay, so he does not need ventilator, he does not need ICU. Doctors know that I have to say this, but they don't know how do I say this. Okay, and it matters, doctors, it matters big time that how do you say this. All right. Okay, doctors. Now let me answer. Lots of questions or queries are there in your in the group. Now, doctor, how you have to end this station? Please offer her. Sometimes the station can even say that daughter is pregnant, and do ask about her. How is she feeling? Even before, if at all the station says that she is pregnant, please care for her first. That will increase your interpersonal skills scores. Ask her how is she feeling, how's her pregnancy going so far. Just 2 questions can increase your interpersonal skills. Okay, please, if her condition is not better herself and you are giving her a bad news, which is not good. Okay, if at all the task says that she's pregnant as well. All right, if she's pregnant, she says to you, the doctor, can you keep my father alive until I deliver my baby? Okay, then you cannot do that. And how to answer that? Okay, how to answer that? Now, as I said earlier, Miss Eliza, but the team believes that he should not be given chest compression. Mr. David should not be given any chest compressions. And if at all we will if at all we try to do that, we will actually be troubling him for no reason. And I'm sure as a daughter, you wouldn't want to trouble him. You would want to let him go peacefully. Okay, I'm sure you would also want to let him go peacefully. Okay, doctors, sound logical. Okay, don't just say no, we can't. Okay, we can't. Yeah, the answer is that. The answer is that you can't keep him alive. Yes, I know, I do understand. The answer is that, but you have to answer it very smartly. Okay, you have to answer it very sympathetically. All right, doctors, please make sure, because if at all Breaking Bad News Station is a phone consultation in your exam, please make sure you bring it in your voice. Okay, I did mock the other day with a doctor. He was saying absolutely everything, but it was not coming in his voice. Okay, so you have to bring that husky voice, that sad voice. Okay, it has to come in your language. Now, in body language, usually we say that you have to bring it on in your body language, because on phone consultation you have limitations. Okay, and you can't show it in your body language, the sympathy and empathy. That's why show it in your voice at least. Okay, be a good actor. All right, could you please repeat the last line regarding keeping alive, please? Okay, doctor. Dr. Afreen, I said when she says that, can you keep him alive until my baby arrives? You first of all, oh, okay. By the way, one of the doctor, that reminds me of another thing. One of the doctor, I was doing the mock, and I think she saw in the in the task that the girl is pregnant. Okay, and you know what she did? She said, it's a Breaking Bad News Station, for goodness sake. um, and she started the station like this: well, congratulations on your pregnancy. Doctors, please, it's a Breaking Bad News Station. I know that you have been attending some online course sessions, online free sessions, and everybody tells you that you have to congratulate whenever any woman is pregnant. But for goodness sake, understand the situation. Okay, it's a Breaking Bad News Station. Don't start it with congratulations. Okay, if at all, okay, if at all it comes, okay, if at all the topic comes later on, when she tells you that she's pregnant, or you can say, I can see from my notes that you are pregnant. How are you feeling, by the way? Okay, how are you feeling? How's your baby? Is everything all right for you in your pregnancy? Okay, regarding your pregnancy, is everything all right? Everything is smooth? You're caring for her. Okay, so that is your interpersonal skills, not congratulations in this particular station. Okay, all right. Now when she says keep my father alive, then say, I'm sure Mr. David would have been very happy in this situation as well. Okay, he would have been very happy for you now that you are pregnant. Okay, but unfortunately, if we try to, as I said to you earlier, if we try to give him chest compressions, he will not benefit from it. Okay, or you can say that the team believes that he should not be given the chest compressions. The reason why is because his condition is terminal and he cannot get better. He will not be, unfortunately, I wish I don't have to say this, but unfortunately, he will not get better. If we are trying to revive his heart, we will be just troubling him even more. And as a daughter, I'm sure you wouldn't want this for him. Okay? Doctors, did you understand? You are just bringing her in the scenario so that she also believes that, yes, my father shouldn't be troubled anymore. If he's going to die, I should let him go peacefully. Okay? Well, doctors, all right. Okay. Right. Yes, doctor, I am planning to join NHS, and I have kind of joined NHS. Some doctors are there just to point out on others. So doctors, please, negative people, stay away. Don't join my sessions. All right. I would request you. There's no place for negative people here. Okay. Whether you send me a message publicly or, um, you know, non-publicly, privately, whatsoever, please, I am not ready to take any shit. Okay. All right. Okay. Yes, doctor, when ventilator, we are not putting him in on ventilator as well, because the ventilator is not needed right at the moment. We just have to tell her that your father, because your task also says that it might say that his father is breathing on his own, or does not indicate any need for ventilator at the moment. So that's what you have to tell. Okay. All right. No problem, doctor. I just see that, this negativity only comes because there is a lot, the market has been saturated with online courses. And this negativity is only there because some people leave their agents to other people's sessions. So this negativity is only from there. People who are truly here to prepare for Plab 2, they don't comment like that. Okay. All right. So what other doctors said? Let me read, doctors, your comments. Okay. The question is, what would you like me to call you? What, according to GMC? Well, GMC never gives a sentence, doctor, that you should, GMC does not give you English sentences. All right? All right. Shall we do open question? Like, could you please tell me a bit more about his blood pressure? Well, doctor, if you're asking directly to the patient, these kind of open questions, can you please tell me more about his blood pressure? That patient himself or herself can give you a lot of information. But when you're asking someone else, they might not be able to give you information. So yeah, there's no harm. Initially, you can ask open question about, if at all, how is his general health overall. You can ask open question like that. But then blood pressure, you may have to ask you specific focused questions as well. Okay. I'm afraid I'm afraid to say your father is terminally ill. Why can't we say? You can say, doctor, why can't you say? Yes, you can say. That is too early to say how much time he is left with. Yes, you can say this as well. What should we say if patient asks if it is serious? I think I have answered that question. how much time is left with? Should respond queries at the end. Don't read the remote and ways to see all that. NG tube, catheter, they part of palliative care. Doctor, NG tube, sometimes patient may ask you about the NG tube, okay? Well, they are not part of the palliative care in the UK, okay? Catheter, I think you can pass, if at all. Catheter you can pass, but NG tube, no, okay? NG tube is not part of palliative care. Could you please repeat the last line regarding keeping alive? Okay, I have done that, okay. All right. Thank you, Dr. Afreen. When we have to say, how's your father is doing? And she respond that he's doing good, what to say next? Doctor, asking too many questions before BBN, you will lose marks for data gathering if you have not asked the questions. However, if you have revealed the bad news and then you intend to take the history, then you will be pissing off the patient, okay? Then you will be really, really pissing off the patient. Sorry for my language, but yes, because you you used it, so I'm using it as well. So yeah, you'll be annoying the relative, okay, if you're intending to take the history afterwards. So it's always wise that you take you haven't told her that you have a bad news for her father as yet, okay, and you are asking few questions and then you are going to reveal the bad news. All right, doctor, I hope it makes sense to you. Okay. If we ask, could you tell me more about his blood pressure? Oh, okay, right. Yeah. Okay. All right, doctors. So doctors, anyone has any more questions? Doctors, the paid course is going to start. Some of the doctors were asking me questions initially about the course. So the paid course is going to start from 8th of September. Okay. Thank you, doctor. Thank you, Dr. Ijaz. Okay. So it's starting from 8th of September. It's a 2-week course. Okay. Previously, it used to be a 25-day course with less hours, but now I have increased the hours per day because I thought, for some doctors, it is not manageable to, arrange so many days for the course. So that's why I have shortened it. Not the stations, the amount of stations that we cover will be the same, but it's just increase hours. We'll increase hour each day. Okay, so instead of having a 2 to 3 hours class, we'll have 4 to 5 hours class, okay, every day. All right, you're welcome, Dr. Mina, and I'm so glad to see you here as well. You are here as well. Lovely to see you. So that will be there. Okay, now the group of 3 doctors do get discount. Okay, there is a discount. There is a £50 discount. The whole course fee is £150, and if there's group of 3, you get £50 discount. All right, so any further information you can message me in the in the group. Okay, I will, if at all some of you are not part of the Telegram group, I will share the link here as well. Okay, right, let me copy and paste the Telegram group. All right. Okay. Right, doctors. Doctors, I said the course fee is £150. Okay, 150. Okay, but if you have group of 3, then you get discount. All right, you get discount of £50 each. So then, if 3 members are there, they pay £100 each. All right, doctors. So Yeah, any further information about the course, you can message me, you can text me. I will even leave my number here if in case. Doctor, the course will start at 4 o'clock UK time. Okay, it will start 4 o'clock. And anybody, if at all they ever miss any sessions, it is always covered. Okay, whatever, if you have any personal problem and you miss the session, you will always be covered for that, as unlike other online courses. Okay, and you are given support until you pass the exam. It's not just that the course is over, everything is over. Okay, you are given support. Yes, doctor, it will be like that. Mostly, most days it will be 4 hours. We can go a little bit over 4 hours sometimes. Okay. All right, doctors. So any other questions at all, doctors, regarding Plab 2 exam or any stations or anything at all? Doctors, the course is for 2 weeks, okay, without any break. We will not have any day off. We used to have Sundays off, and we used to have a whole 25-day course. We used to have Sundays off previously, but I have noticed that doctors, it's quite challenging to attend a long course. All right, so that's why I thought in less days we will cover the same thing, but we will just increase the days, the hours every day. All right. Yes, 14 days, doctors, 2 weeks. Okay, Dr. Ijaz, no worries. Yes, Dr. Christian, yes, EpiPen we will cover, okay? EpiPen and cystic fibrosis before the paid course starts on 8th. Before 8th, we will cover both of these stations, okay? We'll cover EpiPen and we'll cover cystic fibrosis as well. Well, okay, doctors, I will try to send the notes. Yes, doctors. Yes, there will be some more free sessions before the course starts, okay? Every now and then when I have break between the course, I always try to give free sessions so that the doctors who are in the group, they are always doctors. By the way, if you are in my group, I don't know why you doctors, I always looked for somebody whom I could ask questions. When you ask questions, trust me, I will answer them and everybody will benefit. I used to, because academies leave you uh, like orphans. They leave you like orphans and nobody is there to answer your questions. So I used to look for somebody who could answer my questions, but you guys don't ask any questions in the group. Everyone will benefit. Okay, I'm more than happy to answer your queries if at all it's regarding any station. Okay, so while you're in the group, please don't feel like that. Even when I'm conducting the course, doesn't matter. If you are in my group, you are under so I'm actually more than happy to answer your queries. All right. Okay, doctors. Okay, no problem, Dr. Afreen. I have you know what, I'm not showing off, but I have seen doctors who were attending the other academy course. They have paid the full fee and it makes me feel so good, but I feel bad for them that they left the course over there. They left their fee and they came to join my course. So that's not a problem. All right. Okay. All right, doctors, no worries. Okay, I want everyone to just benefit as much as I can help. I will try my best. Okay. All right, doctors, so you take care and I shall see you with the next free session soon. Okay. Okay, doctors, thank you, doctors. Just remember me in your prayers. All right. Doctor, one of the doctor has asked about the ductal carcinoma in situ. doctors, any further treatment that whatever will be done, okay, you don't have to tell particularly that what further treatment will be done, okay. You just have to give that what is important in ductal carcinoma in situ is you don't have to confirm it anymore, okay. The treatment, the expected management that you have to tell is lumpectomy or mastectomy, okay. As long as you speak out these two words, you are covered for management, okay. You are going to refer this patient urgently, and you are going to tell her about that, you know, the surgeon will actually they have a multidisciplinary team, they have a surgeon as well, and the surgeon or the doctors will speak to you in great details. They'll explain to you about the surgeries as well. But two most common, okay, two most common procedures that are done is lumpectomy. If at all it is confined and it is not spread to the whole breast, then they will just remove the lump. However, if at all they see that it is spread to the other ducts as well, then they will remove the whole breast. But don't worry about that. The reconstruction surgery is under NHS, okay? The cosmetic procedure for the breast reconstruction is covered under NHS. You don't have to pay for this, okay? Yes, doctor, hopefully we do have this month. I, you know, at any time, if I get a job, if and when I get a job, or if I decide to do a locum in between, I do locum in between. The doctor who had the query that have I joined NHS or not, I do locum here and there. So if at all I'm doing locum, I don't know. Okay. All right, doctors. So doctors, you take care. You're very welcome, doctors. Take care, and I shall see you soon. Okay. All right, doctors. Bye.